Thanks for inviting me. I'm still a working GP. I see patients 5 days a week. Um, what you've heard John outline is quite a detailed case for what's going on to the NHS. I want to simplify it and point out, because you can get lost in the detail, what has happened over the last 30 to 40 years has been a cross-party conspiracy against the public interest to repurpose the NHS from something that was beautifully efficient, had a very low overhead of about 4%, into something that is now totally dysfunctional, very top heavy in terms of management and administration, and delivering worse care, and in a lot of cases causing harm. The reason I still campaign is I see the effect of this on my patients on a weekly, if not every other week, how they are being damaged by the system. This hasn't happened without the cooperation of the media. The media are key in maintaining ignorance, and they have created a public perception. Whenever you hear any news article about the NHS, it's how it's failing, and isn't this so tragic, and how can we afford it? These are all very cleverly crafted talking points. And it's easy to fall into the trap of using their language and saying, well, we need more money. The problem isn't one of money. The problem is of where the money is going. In this 30-year transition, we have had embedded within the NHS organizations such as, and this is the one you need to remember, United Health. United Health are America's largest insurance conglomerate, and they've dominated the back office work of the NHS under the name Optum. Optum is a UK subsidiary. We have had a series of legal steps which have repurposed the NHS, finalising in July of this year with the Health and Social Care Act. That was the final legal change required to convert us into an American managed care model. Now, if you hear somebody who supposedly knows what they're talking about telling you the NHS is somehow under threat in the future, you are listening to a charlatan or an idiot. The NHS has effectively gone. In 2012, the fundamental root of the NHS, which was the duty of the Secretary of State to provide healthcare, that legal duty was abolished. There is no legal duty on government now to provide healthcare, and there hasn't been for a decade. In July of this year, what the Health and Care Act did was actually create 42 new public-private partnerships. Public-private partnership. That means the public pay and the private profiteer. That's what that means. That's a very simple explanation. These public-private partnerships are dominated by United Health, people trained by United Health, and private providers. John mentioned the NHS Confederation. The NHS Confederation is a club of NHS trusts and private providers. Yeah? The distinction between what is NHS and what is private is extremely blurred. This 30-year transition has allowed the NHS leadership to be handpicked and moulded not to oppose anything that has taken place. In 2006, there was an agreement struck up between Patricia Hewitt, the then Labour Health Minister, and the health unions not to oppose any of this. The July 2022 Act was signed off in its white paper, amongst others, by the British Medical Association, the Royal Medical Colleges, the RCN, the GMB. These are the people who are now telling us we're going to fight for the rights of our workers. Yeah, so if you're in any of those organizations, you need to start asking some serious questions about your leadership. So they rubber stamped the white paper that now has become law. Yeah? Effectively, these new public-private partnerships are business entities. They will have a fixed budget to look after a population of 2 to 3 million people. And from that fixed budget, any money they don't spend on care will be taken as profit. How do you maximize profit? Number one, you screw the staff. Yeah? You suppress their wages. You keep them down. You employ the fewest number of staff you can get away with, and you downskill the workforce. Downskilling the workforce means you replace doctors with nurses, nurses with healthcare assistants with volunteers. Yeah? Does anybody know about the Swiss cheese model of health and health safety? What it is a series of Swiss cheese, slices of Swiss cheese. If somebody falls through one hole, usually they're mopped up by the next line of defense. Well, what this model of de-skilling does, it makes these holes very big and more people die preventably. In July alone, John alluded to this, 30,000 people were waiting more than 12 hours in A&E from the time the decision was made to admit them. For every 80 people who wait more than 12 hours in A&E, one extra preventable death. So do the maths. That's a lot of preventable death. Now, that's not only a tragedy for that person. Their pain has gone. They've died. They're not experiencing any pain anymore. Look at how many people that touches. Their families are bereaved. The staff have had to witness that neglect. Those staff are damaged. The people who can't take anymore walk out. The very staff we need, people with experience of how the NHS used to work, people with an organizational memory, people with compassion, if they're not desperately trying to feed their families and service a mortgage, they are exiting at an alarming number. The very people we need to restore the NHS are hemorrhaging. What is my personal experience? My personal experience is patients who have barn door obvious diagnoses go to A&E and are often turned away with serious illness. A patient, in their mid-40s, a female developing painless jaundice, to any medical student, the diagnosis is pancreatic cancer, jaundice without pain. This lady was sent home with a diagnosis of viral hepatitis. Go away, take some paracetamol. Another patient with severe 11 out of 10 pain in the kidney area, sent home as a urinary tract infection, which clearly had kidney stones. The problem with all of these failures is when they eventually do get treated, it takes a lot longer to recover and it's often more expensive. The NHS we have now is not the NHS I want to defend because it is totally dysfunctional. What country which is operating a rational system decides in a pandemic to stand down the primary care workforce? Does that make any sense to anybody? Yet, how many GPs engaged their critical thinking skills and said, hang on, this doesn't make any sense, I'm going to carry on? Very few. Don't ask me why. Don't ask me what's happened to the profession to become so brain dead that they can't act in their patient interest. They have to follow diktat from the top. Probably a large part of that is conditioning. They've realized over the years resistance is futile. I'll keep my head down and just follow the money and do as I'm told. That is the state of the profession. I'll give you another example of how pathetic we have become, is that during the pandemic, a diktat was issued from NHS England to discharge potentially infected people back into nursing homes. And they did it. Where was the pushback from the doctors and nurses saying, hang on, this doesn't make any sense. This might kill all the residents in the nursing home we're sending these patients to. So we're in dire straits, and the staff are not in a fit position to resist. The unions are saying one thing in public, but behind the scenes throwing them under the bus. Um, I haven't figured out what's behind that. Maybe I don't want to know what's behind that, but it doesn't make any sense to do that, right? So how else does the system make money? How else do these new public-private partnerships make money? Well, if you become sick and your GP decides to refer you, your referral goes to a referral management center where the computer says no. They're taking the health professional out of the system that decides who gets care. Now, that might be done on a population-wide basis. Nobody will get fertility treatment. Nobody will get both cataracts operated on. If your BMI, your body mass index is over 30, you won't get your knee replacement. So these ICSs will all make their own little organizational decisions about which care they can get away with to maximize profit. And then you will have individual level denial of care looking at your GP records. Yeah, all that confidential stuff you told to your GP thinking it was between you and him or her is now all there for United Health to access, because United Health, America's biggest insurer, is now the owner of more than half of GP patient records. Did you know that? They have bought out a company called EMIS, $2 billion deal. Yeah? We have been incentivized over the years to data mine on behalf of the insurance industry. So every time your doctor asks you about your drinking and your smoking and have you ever smoked cannabis and whatever, that information will be used by the insurance company to decide you're high risk, make some total bullshit up, and deny you treatment. Now, why isn't the BBC telling you any of this? Why isn't Starmer telling you any of this? In fact, why didn't Labour Party under Corbyn tell you any of this? These are massive, powerful points, wouldn't you agree? But all they came up with was some pathetic leak of document about the trade deal, which was important. But if you have a whole armory of ammunition to throw at the government, you don't present yourself with a pea shooter. So what's going on? What is going on? They have decided to abandon the population. Private finance capital rules the world. The NHS and its budget are a gold mine, 120, 140 billion pound a year. And if we can siphon as much of that away offshore to private companies that don't even reside in this country, then so be it. And if the people allowing this to happen can be shareholders in these interests or become directors of these new public-private partnerships, great. So our system is totally corrupt from the top down. If you see anybody holding a NHS board position, well, they've been through the 30-year screening process, right? They've selected out the sociopaths. They've selected out the greediest, most ruthless people. And these are the people we're going and pleading with, asking them to be reasonable. The time for polite debate is over. The time for engaging and exchanging statistics with these people is over. Yeah, we need to become far more radical. We need to identify the people on these boards and make their life hell. You're not going to get anywhere with pleading, and you're not going to get anywhere pleading with the politicians. If you're in a union, you need to ask some serious questions about what your unions are doing. Why have I put this graph up? It's a bit faint, but this is a line of the UK. As you spend more money in a publicly run system, you get a almost linear rise in life expectancy. Then it starts to plateau out. The line we're following is the red line, which is more than twice as expensive, and you die younger. It's not about money. They're making the system more expensive. It's just that half of it will come through taxation, and the other half will come through your life savings or your insurance policy. We are abandoning a very rational, very efficient system to copy a dysfunctional, sociopathic, but very lucrative system. If you hear a politician talk about, I'm going to spend more than the other guy with a different color rosette, you're being hoodwinked. If you hear a health union leader saying, we want more money for our nurse or our doctor, but they don't explain why the wage suppression is part of a bigger game, then you need to ask the question, is this person an idiot, or is he deliberately keeping these two issues separate? In 2016, there was a junior doctor industrial action. It had mass public support. These were newly politicized doctors. They were eloquent. They came across well on television, and they were getting somewhere. That was a critical point where this could all have been stopped in its tracks. The BMA sabotaged it. Our own union sabotaged that industrial action. This is the same union now who's pleading we're going to get our junior doctors' pay restored. Expect another sabotage unless the junior doctors are savvy and know what's coming next. Yeah. So the take-home points are, this is a largely US corporate takeover of our health service to take publicly funded money and topped up by private insurance or paying out of pocket to enrich shareholders and to enrich CEOs. This is a theft that's taking place. Is that simple enough for you guys? We're being ripped off and we're being lied to whilst they're picking our pockets. So we shouldn't let this happen, obviously. I don't want it to reach the point where people only realize what's happened when they're at the point of death in an A&E department when there's nobody there to look after them. Yeah? And we should not be only appealing to people like ourselves, because the actual targets of this con are the middle classes, because they want their insurance premiums only to abandon them when they get a cancer or a life-threatening illness. Yeah? They're our allies. And, I've endured some right-wing people's company, but when you explain this to them, they are outraged and they come up with more dramatic remedies than we've come up with. Our remedies are marching around and causing no disturbance, right? I don't mind hooking up with other campaigners. It's great. It's good for networking, but it achieves absolutely fuck all. Yeah. So we need to start thinking, how radical are we going to be? What risk are we going to take? Are we going to challenge our leaders or just follow them like dummies? Yeah? Over to you. Thank you very much.
Thank you. Thank you, Bob. And I think that's especially for me, because I did not know, and I was lied to by my own union, the GMB, about that. So I will be taking that up and I will feed that back to the party, because I'm not very happy about that. And that goes back to another point, holding our leaders to account. That it goes, and I've said this before many times before, especially within the trade unions, the amount of time unions will operate without the endorsement of the wider membership. And I think back to the British gas dispute with the GMB. The GMB leaders there didn't want the strikes to take place. They didn't want to fight the deal. They wanted to accept fire me hire. It was the members who forced those strike action upon the union. It should never be that case. The unions are there to support workers and back them up all the way, not disregard their thoughts, their feelings, what they want to do. So if you are part of a union, don't allow the union to dictate the direction of your workplace. It's your workplace. The organizers like myself exist to support you in that workplace. And so serious questions have to be asked, because I really feel quite embarrassed and ashamed that I've spent time promoting the union to hear that they've lied to me.